Hoi everyone, welcome back to the channel. Today we're diving into a story that's been making headlines across the nation, the Texas measles outbreak. With over 146 cases reported and tragic losses, this outbreak has become one of the most significant public health crises in recent years. But what's really going on? Why is this happening now? And what can we learn from it? Stick around as we break it all down, from the facts to the deeper implications. Don't forget to like, subscribe, and hit that notification bell so you don't miss any updates on stories that matter. Let's start with the basics. As of today, Texas is grappling with its largest measles outbreak in nearly 30 years. The numbers are staggering: 146 confirmed cases spanning 9 counties, with nearly 100 cases concentrated in Gaines County alone. Tragically, this week saw the death of an unvaccinated school-aged child, marking the first measles-related fatality in the US in a decade. So why is this happening? Health officials have pointed to several factors, including declining vaccination rates and clusters of unvaccinated communities. But before we dig deeper, let's take a moment to understand what measles is and why it's so dangerous. Measles is one of the most contagious diseases known to humans. It spreads through respiratory droplets when an infected person coughs or sneezes. Just one person can infect up to 9 out of 10 unvaccinated people they come into close contact with. Symptoms include fever, cough, runny nose, and a telltale rash. But it's not just about discomfort. Measles can lead to severe complications like pneumonia, brain swelling, and even death. This is why vaccination is so crucial. The measles, mumps, and rubella (MMR) vaccine is incredibly effective at preventing infection. 2 doses provide about 97% protection against measles. Yet in some areas of Texas, vaccination rates have plummeted below the critical 95% threshold needed for herd immunity. In Gaines County, for example, only 82% of kindergartners are vaccinated. A far cry from what's needed to stop outbreaks like this one. And it's not just about individual choice. Low vaccination rates put entire communities at risk. So why are fewer people getting vaccinated? Experts point to a rise in vaccine misinformation and skepticism. Social media has amplified unfounded fears about vaccine safety, leading many parents to opt out of immunizations for their children. Texas law allows exemptions for reasons of conscience, including religious beliefs. While this may seem like a personal choice, the consequences are anything but personal when outbreaks like this occur. The human toll of this outbreak is devastating. Leah, an expectant mother in Lubbock, has been avoiding public places out of fear for her unborn child's safety. Meanwhile, healthcare workers are working tirelessly to contain the virus and care for those affected. One father shared his fears about bringing his newborn into a world where such preventable diseases are making a comeback. These stories remind us that outbreaks aren't just statistics, they're deeply personal tragedies. In response to the outbreak, health officials have ramped up efforts to promote vaccination. Clinics are offering vaccines on a sliding scale, and public messaging campaigns are targeting vulnerable populations. But is it enough? Some experts argue that more aggressive measures are needed to combat vaccine hesitancy and ensure higher immunization rates. This outbreak serves as a wake-up call. The US declared measles eliminated in 2000, but declining vaccination rates have allowed it to resurface. It's a stark reminder that public health achievements can be undone if we're not vigilant. So what can we do? First, we need better education about vaccines, what they do and why they're safe. Second, policymakers need to consider stricter vaccination requirements to protect public health. That's it for today's video. The Texas measles outbreak is a complex issue with no easy solutions, but one thing is clear: vaccination saves lives. If you or your loved ones aren't vaccinated yet, now is the time to act. Thanks for watching. Don't forget to like this video if you found it informative and share it with someone who needs to hear this message. And subscribe for more content like this. And let me know in the comments. What are your thoughts on the measles outbreak? Stay safe, and I'll see you in the next video.